and welcome to the Summit Women's Network Talk Show. This morning we have as our guest Robyn Mcwilliams. She is a Social Security disability attorney with Weisberg and Broadstein. Morgan and I can't remember it right. I know. Morgan and Weisberg. Morgan and Weisberg. As everybody knows, she's my Social Security disability attorney. Today we're going to talk a little bit about, because although some of you don't need or are past the place of Social Security disability and you're on Social Security, you have loved ones who needs this information. You need to know what you need to do to qualify for Social Security disability. You need to know about the paper trail. You need to know a whole lot of information that I want to get to you today, because for those reasons, a lot of those reasons, I was deemed disabled, but I was not able to get my Social Security disability because I didn't have a paper trail, because I waited too long. Different things like that. So we're going to talk about some things like that today, so that you guys will be armed with information that you can share with the people that you love, who you know has had disabilities and problems, and want to get their Social Security disability. So I'm going to introduce to some of you and present to others, because some of you know Ms. Robyn Mcwilliams. So, Robyn, tell us a little bit about Social Security, just the basic thing. What is Social Security disability?
So Social Security disability is an insurance program. When you pay your FICA taxes when you're employed, part of those taxes go to pay the premium on your insurance. A lot of times I compare it to automobile insurance when I'm talking to my clients, because they'll tell me, I paid in for 20 years, I want my money, I deserve it. Well, Social Security disability insurance is just like auto insurance, also in the fact that if you stop paying your auto insurance premiums, they're not going to cover you just because you had that policy for 20 years. Once that policy gets canceled because you're not paying, that's gone. It's just all out the door. If you stop working, even if you've worked for 20 years, paid in the system, paid your premiums for that insurance, once you stop working, they'll actually cover you for anywhere from 3 to 5 years, depending on how long you've paid into the system. But there's going to be a point that that insurance ends because you're not paying into the system and paying those premiums any longer. And so it's very important, even if you're self-employed, if you work for your husband who pays you as an employee, always make sure that you file your tax returns, even if it's for a loss, because all you have to do is make $1,000 per quarter. That's $4,000 a year. You get covered. You get 4 quarters of coverage for every $4,000 a year. So, you may think, well, I don't make enough, it won't matter if I file. It does matter, because you need to report to the government that you've paid that you've made that money, so that they'll pay your FICA taxes for that quarter and that year. And even if you've been working with somebody, like it happens a lot when somebody has a spouse who owns a business and they work for the business, but the spouse doesn't report them as an employee, or they don't report the income, you can go back and file amended tax returns. You'll just have to get a CPA to do that. The more you can work, the more you can extend out that insurance coverage. Now there's another program called SSI. SSI is Supplemental Security Income. It's like welfare for disabled people. It has nothing to do with your work record. Financially, they're 2 completely separate programs. You have to qualify medically for both. SSI is like welfare for disabled people, and you have to qualify. You cannot have more than $2,000 in assets as a single person, or if you're married as a couple, you can't have more than $3,000 in assets. Now you can own a house and 1 car, and that won't count toward that $2,000 or $3,000. But so you have to be pretty poor, and you can't have more than $733 coming in per month, or that knocks you out of the bracket, because the most you can get from SSI is $733 a month. So it doesn't pay much at all. It comes with Medicaid. Now sometimes it's important, if you can even get $1 of SSI, to get the $1 of SSI, because as long as you qualify for $1 of SSI, you get Medicaid. Sometimes that's what you need. It's retroactive and will pay back to the beginning of your disability. It'll pay your medical bills that are outstanding, and sometimes that's hundreds of thousands of dollars, depending on what's happened. So it's very important to try to get everything you can. If you have to apply, they will let you apply for everything that you might possibly qualify for. So they will let you apply for SSI and SSDI, But they may send you a letter later saying, well, we delved into it a little deeper and you have too many assets for SSI, so we're denying you for that part of the claim. And that's okay, because you'll still have the other claim pending. The worst thing that can happen is to fall between the cracks. You have too much money for SSI, or your spouse works and makes too much money. Sometimes even if your spouse is retired and getting some sort of a retirement check, that can even knock you out of SSI. You have to have so little money to qualify. In the meantime, if you never worked, or if you worked and it's been 7 or 8 years since you worked, you may no longer be qualified for SSDI, and that's the bad place to be. So that's why it's very important to pay into the system, make sure that you always report any income you get. Like I said, even if you're self-employed or you think, you may say, I only made $4,000 last year, that was not even worth it. But if you report it, you can at least get your SSDI coverage. Now, I've had a situation come up several times just recently in the office, and in fact, when I get back today, I've got to call a client about this. The difference between your regular retirement, your early retirement, and your Social Security disability income. If you wait until your actual retirement age, whether it's 65, 66, 66 and a half, or 67, whatever they've deemed based on your birth year, then you get your full retirement amount. Let's say, for simplicity purposes, we'll say you get $3,000 a month if you wait till full retirement age. If you take your early retirement at 62, it's of course going to be a lower amount because they're going to pay you less for longer, in theory of how they've got the system set up. So let's say you're going to get $1,500 a month if you do early retirement at 62. But if prior to age 62, say, and you can get Social Security disability up to full retirement age. You don't have to, if you're 62, you can still, and that's when you become unable to work, you can still apply for disability. That goes up until full retirement age because, and I'll explain all that in just a moment. So let's say early retirement's $1,500, but let's say you get disabled at age 58 and you have to get Social Security disability income. Well, that payment is actually, let's say it's $2,000. The reason I'm giving these numbers is early retirement's going to be the least amount of money you get. So if you qualify for Social Security disability insurance, even if you qualify at age 34, it's going to be a lower amount than full retirement, but it's going to be higher than your early retirement. So if you do get it at age 58 and they start paying you, you're going to get the $2,000 a month from there on out. They're not going to switch it down when you turn 62. They're not going to move it up when you turn 65. I have a client right now who said, well, I just want it when I turn 65, I want my full retirement then. Well, you've already started getting your disability and your early retirement. You don't get to change the amounts. And what they'll do, if you start getting $2,000 a month at age 58, when you turn 65 or 66, your full retirement age, they just change the name of it. It's going to be the same amount, the same check. It's going to come the same time every month. They're just going to call it retirement at that point. And because you just started getting your retirement a lot earlier than some people. And so that's the difference. They don't switch around the amount, but getting disability is going to be it's usually a few $100s difference from getting early retirement. And so what I've got a situation now is somebody who went ahead, they filed for disability, but they were about 61 and a half when they filed for disability. So when they were able to get early retirement, they started getting it. And so now that we've got the disability, they're going to go back and pay them for every month that they got $1,500 a month. They'll go back and pay them that $500 difference. And so they'll get a little back pay check for what they should have been paying them the whole time they were disabled. Is that clear as mud? And then what I was going to say about the retirement age, Social Security considers somebody who's disabled, their definition of disability is that you're unable to sustain any substantial gainful activity. Basically, that means you can't do any job in the national economy. And so once you reach 65 or 66 or 67, whatever the current retirement age is for your birth date, then they're not going to, you're not going to be working anyway. So why would they, if you can't work, why would they pay you for not working? Because you're not working anyway, you're retiring. And that's why it switches over to retirement at that age. That's why you can't file for disability if you're 68 or 69, because they're saying you were going to retire anyway. You wouldn't have been working. So, what else?
That makes sense. I was going to talk a little bit about that. When you wait, in my case, when you wait before you file, although you're disabled? What could happen?
Let's say, I'm trying to think, okay, you have heart surgery and you think, I'm gonna go out, I'll be out 6 months, have my heart surgery, and then I'll go back to work. In the meantime, you don't recover as quickly, or you end up having to have several surgeries. Maybe they have to go back in and put a stent in or do some other little procedures, or something else develops along the way, or something worsens. Say you already had some back pain, but after that 4-hour surgery on the table, then your back starts giving you a lot more trouble too. But you keep thinking, that's okay, I'm gonna go back to work. Maybe your job offers short-term disability or long-term disability, and people will say, well, I was getting paid, I didn't need this. Well, if you wait too long and then you look for a job, maybe you lose your job in the meantime, you wait 3, 4, 5 years, and then you apply. Well, if your insurance ran out prior to that, there's a chance that you won't be able to prove your disability back prior to the end of the insurance. And if your insurance runs out December 31st of 2016, it doesn't matter if you got run over by a Mack truck and break all your limbs on January 1st of 2017. You're not covered anymore. Just like with an automobile. If you stop paying your premium and your policy gets cut off on December 13th of 2016, it doesn't matter if you total your car on January of 17. You're not covered anymore. And there's no mercy from them. There's no mercy from the Social Security Administration either. They don't want to dole out that money right now because they know that funds are tight. And unfortunately, some of these judges now are treating it like it's their own money and they don't want to give it away. But on the flip side, if you do, it's also very important to always get medical treatment. If you don't have insurance, if you don't have money, go with Tarrant County, go to JPS. If you're in Dallas County, go to the Parkland system. It's not a perfect system. It takes forever to get appointments. You're waiting for hours, but it's something. Because if you don't get medical treatment and your disability insurance, even if your disability insurance is still good, if you go to the judge and say, I'm disabled, he's going to say, well, where are the records? I don't show that you went to the doctor. Oh, well, I couldn't. Their attitude is if you're hurting so bad or if your symptoms are so bad that you can't work, they're so bad that you're getting treatment. Whether you're having to go to the emergency rooms because you don't have money to pay the premiums or to pay the co-pays or to pay for office visits, or you're going to the county hospital. And these judges understand JPS and Parkland are slow systems. The outlying rural communities that have some sort of indigent care, even worse. You can hardly get in at all. You might be lucky to get 2 appointments a year. But if you at least try, and you can bring up the records and say, well, I tried this, and they're going to get me in for an MRI, but they can't do it for 8 months, whereas a private doctor would have you in for 1 in 3 weeks. They understand that part, but if you don't try at all, and that's the biggest problem I have with my clients. They just sit at home and say, well, I just don't feel good and I can't go to the doctor. That doesn't fly. And so, particularly if your insurance is run out, you've got to have the medical to back it up during that whole time. And unfortunately, if somebody comes to me after their insurance ran out, if they don't have the medical evidence prior, I can't fix that. I can't go back in time and send them to the doctor. I can do a lot to, encourage them to go to the doctor from here on out. That doesn't always do any good. Like Ms. Jackson here, we got her into doctors, we got her doing all that, but before I got a hold of her, she wasn't getting the treatment and didn't have all of the testing that might have made a difference.
Right. They want you to, it doesn't matter whether you're being treated for one thing and something else happens and concurrent to that, so you're still being treated for something and something else is going on, doesn't matter. Because if you don't get treated for the other thing that's going on, even with that thing that matters, you're not going to qualify. They want a paper trail of everything. And if you don't have it, you will not be eligible. That means if it's your knee, and then it's your back, and then it's your head, but you're just dealing with the knee because it's the primary, and you're letting these go secondary, and you're not handling them, there's no paperwork behind it, they're going to deny you. Even if you go to their doctors, this is right, you can go to their doctors, and they can deem you disabled, and Social Security will agree, yes, you are disabled. However, if you do not have a paper trail, you can forget it.
Well, now that part of it, like when you got deemed disabled, the problem there was that they said as of the day, with SSI, they can only pay you back to the day you apply for SSI. With SSDI, they can pay you back to, they'll go back before that. So what happened is when she applied, they looked at it and said, sure, as of today, you're disabled. Her insurance had run out 2 years before, about a year or so before. So they said, well, yeah, you're disabled, but your husband makes too much money and we can't pay you SSI. So we appealed on the SSDI, but we didn't have, and we worked hard to get a paper trail going from a surgery that was way before the end of the insurance. And then there were 2 surgeries after that, but different states, different doctors. We even got her current doctor to say, yeah, all of this went back to the first surgery. And if the judge isn't buying,
still no. So that's why, I'm sorry.
I will say that's a lot to do with individual judges. Had I had a different judge, we might have been able to convince. I can think of 3 or 4 judges off the top of my head that would have bought that argument. And unfortunately, and this is the most aggravating part of it, is it can be so arbitrary, because if you get Judge A, you're going to get approved. If you get Judge B, you're going to get denied. And if you get C, D, and E, it's up in the air depending on how they feel that day. And it shouldn't be that way.
Right, how they feel.
You ought to be able to lay these medical records out and the testimony and the situation, and every single judge would give you the same answer. But unfortunately, they all have their opinions, and they all have their quirks, and they're human.
Right, right. So it's even, as Robyn is saying, it is even more important that you have your ducks in a row. To have your ducks in a row. I moved from Georgia to Texas, and when you're dealing with a surgeon, you have to understand, surgeons do not like to say they made a mistake, okay? They're not gonna say they made a mistake. They don't really like to do that. And 9 times out of 10 times, one surgeon will not go against another surgeon. However, I had a great surgeon. He did. He said, yes, there was a problem with that first surgery. But it didn't matter because the paper trail did not follow like it should have. And because of that, they couldn't do anything with because we had a bad judge.
Yeah, we couldn't convince the judge. We couldn't even convince the appeals council, because we appealed. We couldn't even convince them that this all was related back. And it hurts. I mean, unfortunately, when you move either from town to town or state to state, there's a lapse in care usually, because even if you hit the ground running and try to make appointments, even with private insurance, sometimes it's hard to get an initial appointment with a doctor unless you're going to Care Now or the emergency room or something. But to get into a new doctor, even for primary care, you can wait 6 to 8 months.
Right.
And then the judge says, well, what the heck, you waited? And you're like, I was trying.
Right.
And if you get a reasonable judge, they understand the flow of things. And unfortunately, so many of these judges are upper crust, middle-aged white males who they have no idea the plight of somebody who doesn't have insurance, who was not born and raised with a silver spoon in their mouth, who didn't have the money to go to college. Some of them just have no concept of anything other than their little world. And that makes it that much harder, because they just can't conceive of somebody not having the money to go to the doctor, or not wanting to go to the emergency room because they know that a $1,000 ambulance bill is coming and a $10,000 one-day emergency room visit is coming, and they just don't want to face it. And the funny thing is, a lot of times my clients will tell me, well, I couldn't pay it, so it wasn't fair to the hospital, and it wasn't, they're trying to do the right thing by not making these bills, when what the judges want them to do is build them up as much as possible, because they just want to see the evidence. And so if you get a reasonable judge who understands that everybody's not just like they are, you have a much better chance of convincing them what the problems are. I've won cases where there's almost no evidence, but you get somebody in there who explains every little bit, and you get a reasonable judge, and it can be done.
And so how about the flip side of that, when you don't wait and you go and get your paperwork? How do you handle it?
First, I will say, so many people think they can do this on their own. Oh, I can do it. I don't need an attorney. I'll just go in there and tell the judge about it. That's a big mistake. And anybody who says, you can call an attorney and just ask them about it. I know I'm always willing to give free advice. I'm not going to, say, well, you have to call and make an appointment and pay $350 an hour for me to give you an answer. No, I want people to be informed, and I want them to understand what a complicated process it is. They are going to make you fill out paperwork about that high from the start to the finish, because you apply, you get denied, you appeal that, you get denied, and then you appeal, and that next appeal is a request for a hearing, and then you go before the judge. This whole process takes almost 2 years, and that's if you're lucky, because if something weird happens and they send yours to the side, or unfortunately with the government workers, if it sits on their desk and they go on vacation for 2 months, it's still sitting on their desk. Nobody's coming over wanting to help them out or take some work off of them. And so let's say you get, and I just realized this, during this whole time I didn't mention, one of the other criteria is you have to be unable to do any job for at least 365 days. So that scenario where you might have to have heart surgery and you're out 6 or 8 months, you're not going to get disability for that because it's not long enough. And unfortunately, I've had cases where I had cancer victims who went through chemo, went through radiation, did all of that, but after 11 months, they were better. They just don't qualify. And it's awful. But if they don't, if their doctor doesn't stretch it out, like I had one who, I mean, I had to tell her last week, I said, you canceled your 4th round of chemo because you were tired of it, and told the doctor, I want to go back to work. I said, I can't stretch it out. Had you had that 1 more round of chemo, and then they gave you, time to get over it, we would have been to a year. She cut herself off by 2 or 3 months. These are things that if you talk to an attorney, they can guide you on and advise you, and at least say, look, if you do this, this is what may happen. If you don't do this, this may happen. Because I tell my clients all the time, you have to go to the doctor. I can kind of help find, we don't have doctors we send people to, but when somebody says, I can't, there's no indigent care here, I can look up the county and go, oh, well, Mother Francis, they have a system. Go to Trinity Mother Francis and they'll help you. I can tell them where the indigent care is or help them find somebody who can get them in the right place. But if you don't call an attorney, you just don't know. All of the paperwork, I don't think you can kill your case by filling out that paperwork yourself, but an attorney can sure help say, look, you see all these lines? Don't fill them all up. Don't write a page and a half. Don't write on the back. Don't add a typed page to it. Because what you do is prove to them you can type, you can write, you can work. They don't know that that took you 5 weeks to write and you were doing it, 1 question at a time for 5 weeks. They think you sat down and did it for 2 hours and wrote and wrote and wrote, and they're like, well, they have secretarial skills. I don't know why they can't work. But these are things that you don't know if you don't ask, if you go in blind. And I have a lot of clients who come to us after they've been denied by a judge. Well, that cuts off so much time that you could have gotten paid for. Yeah, we may be able to start a new claim, but if you were working on that for 3 years and then a judge denies you, if the appeals council denies you too, you're dead. That's all gone. All 3 years, once a judge has made a decision and the appeals council affirms it, if that decision was December 31st of 2013, it's already been adjudicated. You can no longer discuss your disability before that. Your next application has to say January 1st of 14. And so why give up 3 years of $1,000 to $1,500 a month payments? It's a lot of money. I think I got off track. Oh, so if you are pretty sure that you may not be able to go back to work, apply immediately. Because, like I said, it takes 1.5 years to 2 years. If you don't have any income coming in, that's going to be a long 1.5 years to 2 years. Even if your job hasn't terminated you yet, because they will ask you when you apply, are you still working? If you say yes, they're not going to let you apply. If you are on FMLA, if you're on short-term disability, if you are not physically getting up and going into work, it doesn't matter if you're still employed because they're keeping you on the payroll or they expect you to come back after a certain time. If you are not physically working, you just say, no, I'm not currently working. Because the beauty of it is you can apply, you can turn in all the paperwork, even if an attorney takes your case. And we do it. Do all that, but in 6 months, if you get back to work and you're working full time and you said, you know what, I'm definitely better, I'm not going to need this, fine. You withdraw the paperwork, all is good. But at least you were 6 months ahead of the game instead of waiting to see if you ever got back and waiting a year and going, well, gosh, it's been a year, I can't work. Now you're a year behind already and you're going to have to wait another 1.5 to 2 years. And so that's why even if you think you might not be able to go back to work, it's best to go ahead and apply. because it's going to be a long wait. And they don't pay any, people call and say, well, will they pay me temporary benefits? No, they're not going to pay you one dime until they're absolutely convinced that you're disabled. So,
Yeah, so I was just thinking that I'm gonna do the right thing. It doesn't work, because that was my attitude. I'm going back to work. I'll be fine. 2 years later, I was still having problems. I couldn't go back to work. I'm having another surgery. I was not fine. It was too late.
and we take these cases on a contingent fee basis, so it's not going to cost you anything. That's another thing. People say, I can't afford an attorney. You can. Social Security determines what we make, how much we make. They cut our fees at 25% of the past due benefit. We get nothing of your monthly payments. And they cap us off at $6,000. So even if you got $100,000 in back pay, we'd still only get $6,000. We wouldn't get $25,000.
Can you get a question?
You know, I want to say this is good for us to know, because I have a friend, and she was in the hospital, and I told her about your case. I said, file for your disability now, because with her condition, we knew she wasn't going back to work right away, even if she got to go back. So I told her to go ahead and file, because I remember what you had said before, and she did that, because come to find out, she could not go back to work at all. So she did get it, and it was approved quickly.
And there you go. And had she waited,
Yeah.
who knows?
And that's another reason why I wanted Robyn to be here today, so that you guys will understand that, you know, things happen. And we try to do what we call the right thing, you know. And my attitude was, I thought they were giving me something. You know, even though I know I pay into Social Security with FICA every pay period, I'm like, I don't need them to give me anything. I can work. I'm going back to work. I had a good job. It doesn't matter. You know, you're not doing yourself a favor. You know, trying to say, I don't need that. You do need that, because if you do not do anything now, and that time goes by and you don't have anything to track it, and like Robyn, I didn't even know about that, Robyn, that you have to be out for a year. I didn't even know that. You have to be out for a solid year. And I know it's going to be that's a struggle if you don't have any money to be out for a whole year and no money. And then we were, because Reggie wasn't making much money. He lost his job. That was 2008, the market crashed. We lost that job. And we didn't have any money either. That's why we had no paper trail, right?
Why do they require a year?
Why do they require a year?
That's just when they set up this program.
Can you live without any money for a whole year?
Apparently it happens I mean, people call us and say, can you float me some money? And we're like, we have 3,000 clients. We can't even give any of you $10 a piece. I mean,
Well, what if we work and they should not deduct for a year Social Security? What if we are working for a whole year and we can't pay Social Security?
That's never going to happen. She said, I'm going to give this to Robyn too, but that's never going to happen. She said, what if you work for a whole year and don't pay Social Security? The government's going to get theirs off the top.
well, and that's why I'm saying you have to
You have to wait a year to get your Social Security funds. Why can't you
Oh,
wait a
I see
year
what you're saying.
To get there.
our Social Security?
Right.
Right, well, they're going to pay you back for, you know, they pay you for that. Now, they don't, another thing is these weird rules that they have, like the 365-day rule. Another odd rule that they have is that for the Social Security disability insurance part of it, they don't pay you for the first 5 full months. So if you say that you became disabled on January the 2nd, they don't even count that because it's not a full month. So they won't pay you for January, February, March, April, May, or June. So, and even if they, like, if you file January the 2nd and say I became disabled today, and they approve you in March, you still won't get a payment till July, because they just, for whatever reason, I guess they assume you have some sort of resources, whether it's your 401k, your IRA, short-term disability, long-term disability, or unemployment even. They assume you have something coming in. And again, I don't know how they came up with these rules, but those are just the rules that actually we can't do anything about. I can't change anything about the year rule. I can't change anything about paying for the 5 full months.
So why do they deduct Social Security to begin with?
To pay to
To pay somebody else, to pay for themselves.
Well, but it also puts money in your account for your retirement and or your disability insurance. I mean, you are paying the premiums with that Social Security every month, or every paycheck. So, because if they didn't deduct it, there'd be nothing there for anyone. You'd be on your own if you got disabled. You'd be on your own if you retire. They'd say, well, good luck.
Saving that money that they don't.
You might not. They kind of force you to have a savings account with it.
Right, exactly, they kind of force you. to have a
Unfortunately, having a job doesn't guarantee that you're good with your money, so they sort of set it aside. So even if you're not, you have something coming in when you retire.
And I know that there's been a big, I see you, Annie, we had a big controversy, everybody knows about that big controversy with Social Security. People, they wanted to say, let people keep their own Social Security money versus letting the government take the money, and that whole big thing. Well, of course, let's say they won, they get to keep your money. So, but at the end of the day, you do get your money back, supposedly, you're gonna get your money back.
Portion.
A big portion thereof, after you retire. You had a question. You forgot? That's, I apologize. I apologize. Robyn was saying something that I wanted to address to, about Social Security. You asked her a question about the Social Security, why won't they let you keep your money, and that kind of thing. And I was gonna say something about that,
Because if they don't deduct it, we can put it in savings and let it build up.
well, you know, they did say at one point that the Social Security was going bankrupt. You guys remember that, right?
Yeah.
And everybody was getting really scared and stuff like that. I think this has really probably nothing to do with Social Security disability, or that this conversation can veer over to something else, and that would be politics and government stuff. But you know, when we're dealing with the SSI, anybody just about with no money can qualify for SSI. If they, right?
If you qualify for the disability part too, you have to medically, they have to find you disabled.
Right,
And that's a state-by-state program. So some states, they treat it differently in every state. And so the rules I'm giving you for the SSI are Texas rules.
okay.
Because some states will give Medicaid to anyone. So Texas limits Medicaid to SSI recipients, mothers, disabled mothers with children, or single mothers of children, because of course if mom's not getting medical treatment and gets sick and she's the only provider,
Right.
they want them to be able to have. So they have very strict rules for the Medicaid in Texas, but I don't know that they're that strict otherwise. You had a question?
That SSI, does it come from the government or does it come from your Social Security?
That is a welfare program. It's not coming out of the Social Security at all, because people who've never even worked can qualify for SSI. It has nothing to do with your work record.
And I'm glad you said that. That made me remember my thought. If you're indigent, and you were talking about you have this year with no money, they do have a welfare system. There is a welfare system. Nobody may not want to go on it, and they may pry into your business and everything like that. But if you don't have any food, they won't give you any money, but they will give you food stamps or that card. I think they have
There's a WIC
some kind of
card if you're a mother with children. There's food stamps. There's housing programs. I have some very resourceful clients who don't have enough money, but they go out there. Now, some of them are in treatment at JPS or MHMR, who also tell them of these programs and help them get into them. There are so many housing programs in Dallas and Fort Worth that will let you live in an apartment so you're not in a shelter. And there's rules. There's always rules. You may have to go to drug tests. You may have to go to certain classes or group therapies. But you know what? It's a roof over your head, and you need to be helping yourself anyway. And so there's a lot out there, but some of my clients just don't, they sit at home and go, oh, well, I can't do anything. And then that's when we try to say, look, you need to call this number, you need to look into food stamps, you need to do this. Because the doctors fill out the form. Food stamps, I think one of the requirements is that you're supposed to be looking for a job. But there's a little 2-page form. You take that to your doctor who says, no, you can't work. You're laid up with knee surgery. You've just had heart surgery. They will sign it. They will say this person is not disabled, permanently disabled, or not permanent, but it's going to last more than 6 months. And they have all these little check boxes. They'll tell them what you can and can't do. Some of them say, well, yeah, they could work 2 hours a day, but they can't work a full-time job. And then they sign off of it. You take it back to food stamps, and that's how you get food stamps when you can't work or look for a job. I have judges who get mad at people for getting unemployment, but in our big book of regulations, if you apply for SSI, there's a specific regulation that says you must apply for any and every other federal or state program that can also help you. That, and I think it specifically says unemployment, food stamps, welfare. So I use that argument. If they say, well, why'd you get unemployment? I'm like, Your Honor, they were required to try to get unemployment per this regulation. And it's hard to hold that against them when you're doing what the regulations say you have to do. And again, like you said, what are you going to do for that year? If you can get unemployment, it's better than nothing. And, you know, and the judge's argument is, if you apply for unemployment, you're saying that you're willing and able to work. If you apply for disability, you're saying you're unable to work. So they try to compare it to a fraud situation.
Wow.
But sometimes people don't realize that they're completely unable to work. Or I have a truck driver who can't do, I mean, that's heavy work. You have to unhook and hook up. But they think, well, maybe I can go work something easier. Maybe I could be an order puller in a warehouse, or, you know, a security guard where I'm not doing all that lifting. So they go to unemployment, they get the unemployment, they try to find something. Either they don't get interviews, or they can't pass a physical for even something lighter. And meanwhile, they've also applied for disability because somebody has talked to them and said, just apply, it doesn't matter. You can withdraw that application and it's not going to cost you anything. I mean, why not? Who wouldn't do that? And then if you don't need it, great, toss it aside. If you do, you're ahead of the game. So absolutely apply for everything.
My son was diagnosed with disabilities in elementary school, and he is an adult now, and he gets SSI and SSDI. He has expressed an interest in trying to work a couple hours. Are there limitations on you can work a little bit but not make over so much money?
There are, but you have to be very careful. Now, if he's just going to work a couple hours, they're never going to get mad at him for
A
that.
couple hours a week?
A week, yes. Even 5 or 10 hours a week, because he's just trying, I mean, who wants to sit and look at 4 walls 24/7? If you can get out and do a little something, great. If he gets over 30 hours a week, they're going to start looking, because the attitude is if you can work 30, why can't you work 40? If you can work 34, why can't you work
We're
30?
thinking January.
Yes, and that's totally below the limit. Money-wise, too, you can make up to about $1,100, $1,200 a month, and then they start saying, well, now this is substantial gainful activity. A good example I always use is Christopher Reeve. You would think he was disabled and qualified for disability. He made like $250,000 for each to give motivational speeches and stuff.
Right.
Well, he was making way too much money, and he still had a skill that he could use despite being in that wheelchair. Like Stephen Hawking, he's not disabled. He can he still uses his mind. He's on Big Bang Theory. He's making all kinds of money. And so he makes too much money, even though physically he can do a lot. But these are highly skilled individuals. Most individuals who were in a wheelchair and couldn't use their arms and legs, they don't have the skills or the demand that Christopher Reeve would or that Stephen Hawking would. So that's a rare situation, but people think just because you can't do certain things that you automatically are disabled. But if he can work 10 hours a week, it shouldn't jeopardize him at all. The more important thing is to still continue to go see his doctors and make his appointments, because they're going to review him, especially if he's been getting it from a young age. They'll review him every 5 or 10 years and just send him a letter that says, hey, we want to know what doctors you've seen, and we're going to update the medical, and we'll get back to you. If they see that he's not taking any prescriptions and he's not going to the doctor, they'll say, well, I think you're doing good. We're going to cut you off. So, but the important thing is if he does start working too much, to report it, because he doesn't want to end up with a big overpayment because they find out. Yeah, but that's not going to be a problem.
Okay.
Thank you.
Talk about SSI, you come out, you got United Charity, you come out and get your nutrition paid, I'll come out and get some food. United Charity in Grand Prairie?
United Charity.
United Charity, yeah, you can always get some food down there, all you gotta do is, you don't have income coming in, all you gotta do is come out and fill out an application, say, I don't have, this is what I made, they want to see your last income.
Good.
You get the food down there.
Good. And this is, I like getting this information because I keep a catalog of all of this and say, where do you live? And when it's, because I can send anybody to United Way, but they might not be able to help them. But United Charities locally, that's helpful to me. And certain food banks, I know when I was in Denton, I knew the food banks around there and places to send them. And so it just, I have to get familiar with each little area. So thank you. United
That's
Charities.
Very good information.
Yes, that's
Very good
great information.
See, and that's the important, go ahead.
What if you never worked and you never did pay Social Security?
Then if you qualify for SSI financially, you can apply for the SSI. But the problem,
You never did work.
right, and it has no bearing on whether you, I've had people that have been in prison for 20 years and got out, and sadly, they have usually a mental disability. That's what got them put in there in the first place. But in the 80s and 90s, nobody understood schizophrenia or bipolar. So and back then, they would make you serve your full 20-year sentence. So they get out, 2008, 2009, and they say, I can't function. And I can imagine how scary it is if you've been in jail for 20, or prison for 20 years, getting thrown out into society as an adult. What do you
don't know what to do.
You don't have a clue. And so we can get it for them. You just have to prove that as of now, you're getting the treatment, you qualify financially, and the judges have to believe that you're not going to, go steal a car and end up right back in jail. But as long as you're getting your treatment, yeah, that's what SSI is for. It's for the people who don't have the work record. The catch there is if you're married and your spouse makes too much money, then you don't qualify financially, even if they deem that you're disabled.
Right, because it's no longer about you then. It's no longer about me and my disability.
It's just
It's
about the
now it's
financial
about
part.
just the financial part. Now, I'm not gonna give you any money, you have a husband. And if you wanna divorce your husband, I'll give you some money.
And sadly, that happens.
And look, how much you owe me? $700?
$733
Yeah, I'll give you
max.
So I'll give you $733 when you divorce your husband and be indigent for a little while. What you think I'm gonna do? I think I'm gonna stay with
Did you
them.
have another question?
What if you don't have a husband?
Then you're okay, unless you have, you're sitting on a lottery winnings or something. As long as you have $2,000 or less in assets, and you don't have a big check of any other kind coming in, or I've had people who had a plot of land that they'd inherited, and they didn't, it was kind of just sitting there, they never did anything. But if you have your own house and this land, that $2,000 or $3,000 1 acre of land can knock you out.
Wow.
You have to sell it, huh?
You'd have to sell it, and then as soon as you were under the asset level, you could apply again.
Wow, that's why a lot of people live on the street.
I have a lot of clients. I have a lot of clients that lived in either currently live or have lived in the Presbyterian Night Shelter and the homeless shelters in Fort Worth. Fewer in Dallas. I think Dallas must, or at least as far as the clients I'm getting, they have a better way to get them off the streets. But I have a lot of clients that are homeless in Fort Worth, and this is a great way because when you get your back pay, then you have money to put down a deposit on an apartment. You have money to buy some furniture. Now the other catch, and this is another one of those not as common situations, but it does happen. Let's say you apply for SSI. It takes them 2 years to pay your case. Well, even at $700 a month for 2 years, that's a chunk of change. They pay you, of course they're going to start paying you your monthly benefits, but if you say have $10,000 in back pay, they're going to pay you $2,000, and then they're going to wait 6 months, and then they're going to give you another $2,000, and then wait 6 months. But they do this for your benefit, because if they gave you $10,000, by the very nature of that program, they would be disqualifying you from their own program.
Right.
Because you have over $2,000. And they figure if they give you $2,000 in 6 months, you're going to pay it, it's going to be down, then they can give you another $2,000, so that you don't have $10,000 sitting in an account and poof, you don't qualify for any month that you have over $2,000.
That makes sense. Thank you, Robyn. Are there any other questions?
I was just gonna say that my dad, he was working, and this people that he was working for, they paid in cash. So he never could apply for Social Security because he never did pay it.
Right, he never, obviously, he didn't pay taxes on it and
then the
report it.
people that he was working for didn't have to pay Social Security on that either.
Right.
So they were paying under the table too.
And that's under the table does not help, it
No,
hurts you.
I'm
People
getting
think
rid
it
of the
helps,
table.
but it does hurt.
Right, I mean, it can bite you in the long run.
That happened. In her dad's age group, mine
Oh,
too,
yes.
that happened a lot because people work farming and so forth, and they work day labor, and nobody ever, and when they turned 65, they didn't have no money. You know?
Right. They have any money?
Right.
Christine. Okay, let's do our door prizes. That time Mr. Vice President, well, guess
Oh,
what?
we didn't do
don't
ticket.
have- We don't have any tickets, but guess what? Christy found this great way last time to do it, and that's what we're gonna do today.
Do you want this filmed?
No, you can